introduce themselves. So my name is Joe Stevens, and I'm a member of the committee of the GaDangme 30th anniversary. So let me turn it over to Maxwell. Dr. Maxwell, please introduce yourself.
Hello, my name is Samuel Maxwell Edu Latte. I'm an orthopedic and spine surgeon here in Houston, Texas.
Okay.
Hello, my name is Susie Akron, and I'm a family nurse practitioner here in Houston, Texas, and I'm also part of the GaDangme 30th Anniversary Committee.
All right, hello, good evening. My name is Anita McCloskey. I'm a financial consultant and financial professional. I'm also a finance manager for oil and gas company in Houston, Texas.
All right, so we have a very powerful panel. Let's give it up for them. So my question is going to go to, first question is going to go to, we're going to cover the topics of health first. So Dr. Edulate, you talked about being orthopedic surgeon. Could you tell us a little bit about what you do, and also if you have somebody who wants to get to you, do they get to you directly? What is the process for somebody who needs to see a surgeon like you?
So I'll start with the first question you asked. What do I do as an orthopedic surgeon and a spine surgeon? So as an orthopedic surgeon, I see and treat people with illnesses of muscles and tendons all the way from your neck all the way down to your foot. So any injury, including your musculoskeletal system, muscles, tendons, and bones, whether you have broken bones, torn tendons, torn ligaments, I fix those. Also, as a spine surgeon, I treat conditions of the spinal cord and the vertebral column, which means anything from your neck all the way to your tailbone. Any injuries of the spinal column or ailments of the spinal column are treated with either conservative treatment or surgery. So that's what I do on a daily basis. To get to me, usually depending, it depends on what kind of insurance you have. Some insurances require seeing your primary care doctor first, and the referral is made to see me. Some insurances doesn't require that, which the ladies will tackle later. But when in doubt, you can call my office, and they will lead you down the right path as to see me. So if you have any injuries of the musculoskeletal system, as we mentioned, from neck to the foot, that's what I'm here for.
Okay, great. So Susie, just to follow up with what Maxwell said, sometimes I want to start with, just regular corporate America or just regular jobs. We have insurance coverage, right? But there are times we don't even know, like it's like Greek, right? You got all this stuff that you have to pick different choices. So how do you know what is the best option to pick? Like, what is the difference between an HMO, a PPO? Like, how do you enlighten us on what to look for when you pick a provider?
Okay, so health insurance. So most of my healthcare career, I have to deal with insurance companies. They probably remember my voice because I never give up. So you have a HMO and a PPO. HMO means you have to go through your primary care for everything you need. He's the gatekeeper. You cannot just get up and call Dr. Max and say, I have a broken spine. So you have to go through your primary care, and they get to decide whether you need to see a specialist or not. If you have a PPO, you can get up and go to a specialist. That's it. You just pay your copay, and you are fine. It is expensive to have a PPO coverage versus a HMO coverage. So that's a decision you make when you are selecting your benefits. See what works for you. If you are young and you're not sick all the time, you can get a HMO because all you need is your yearly checkup. You may take 1 or 2 meds, so no big deal. But once you start aging, you want to get a PPO plan because that affects where you get care. That affects where you go for the next level. If you get discharged from a hospital, you need to go to a skilled nursing. Everything affects. So you need to be careful when you choose an insurance. If you don't know, ask. There are so many health professionals in our community, so many. Call somebody, ask somebody before you sign up.
Awesome. So Anita, I'm coming to you. So I mean, we are immigrants, right? And a lot of times, when we come here, we don't have insurance. We bring our family members. What are some of the options that we have if you're not in corporate America or you don't work for Walmart or any of these companies? What are some options that you have if you don't have a job that covers insurance?
Well, that's a great question. So, yes, first off, besides having insurance through your employer, we do have marketplace insurance. So, you come from Ghana, you don't have insurance. Obviously, you have to have a social security in the system. But if you don't, there's also an option to have your item in the system. With that, you can actually obtain marketplace insurance. You can also, go to a clinic. There's so many clinics out there that would allow you to come in and pay maybe $50, or even just for seeing them for the first time. Because sometimes we do have all these insurance, but sometimes you go to the doctor, you still have to pay a copay, right? So there are so many clinics out there, but also we do have community providers too. So depending on the individual, depending on their income bracket, you can also get community services as well.
Max, anything you want to add to that?
Actually, she did a good job.
All right, Susie, anything you want to add to that before we move on to the next question?
So yeah, talking about the community clinics, there are so many around. A couple, Legacy Clinic, they have over 5 buildings. They are spread around Houston, north side, south side, west side. And if you do not have insurance, I strongly recommend try them, use them. They have every single specialist that you can think of. If you qualify, they will take care of you. Why do we say this? Joe will be my witness. We get a lot of phone calls from the community. And the first thing they say is, I don't have insurance, so I never went to the doctor. And I'm talking real emergency. So we want to put the word out there. There is another one. If you live in the downtown area, go to San Jose. It's very easy to do the paperwork. It's not hard. There is one in, they are everywhere. And if you need resources, just ask. We'll get you there. All you need is to get your yearly wellness. Make sure you do at least once a year. Early detection, please. Okay? And once a year, get your yearly physicals done, get your labs done, and then go from there.
I can actually attest to that. So a lot of times, I have pretty good insurance, but if I have to see my doctor, I have to make appointments, and you know how that goes. But there's a clinic right by my house that you can just walk in, pay $50, right, and they'll take care of you. And sometimes what I find out is the $50 is actually cheaper than my copay. So actually, sometimes I use them without even using my insurance. And of course, I use my insurance for medication and all that stuff. So, and I know, Susie, you have one of those. So could you talk a little bit about what you do?
I do. I have I run, if you are on chronic medications, that means blood pressure, diabetes, COPD, anything that you need to take a medicine every day, and you do not have insurance, call me. It's not about the money. It's about you not being an emergency and using that as a barrier for not getting health care. Just call me.
So when you're sick, don't stay at home, right? And if you feel like you don't have insurance, please, there are the clinics out there. You pay $50, they'll take care of you like you go to any doctor. You might have to pay for the prescription medication. You have to pay for that, but go ahead.
There are also a few free clinics around. We live in Houston, which is a big medical center. So usually if you're in a medical center area, they have residency-run free clinics, where residents are training. So, to have patients to train or practice on, sometimes they offer free clinics. You are not a guinea pig. It's just don't people think residency, so people are practicing. No, they are actually being supervised by their attending physicians. It's just that, it's a free clinic, and it helps with your practice and also helps you out. So there are free clinics out there too.
Oh, that's always good to know. If you could get us a list sometime, that would be helpful. So my next question, and I'm going to go straight to Susie. So, and you've said it well. You and I have dealt with some situations this year, and I've actually been enlightened about the difference between Medicare and Medicaid. So, can you tell us a little bit about what Medicare is and what Medicaid is, what the differences are, and why both are important?
So Medicare is a federally funded program by the government. It's only 3 ways to get Medicare. 1, you have to be 65 and up, and you have worked in the U.S. and paid your Medicare taxes. If you don't have the 40 points, you will not be eligible for Medicare. Second option is to, not that you want to have ESRD, but if you are chronic kidney failure, that you need dialysis. The day they declare you to be end-stage kidney failure and you need to be on dialysis, that day you get qualified for Medicare. That's CARE, Medicare. The third option is to be disabled. You get Medicare by disability. So 3 ways: 65, end-stage renal failure, or disability. That's the 3 criteria. The other one is Medicaid, which is income-based. So anybody can apply for Medicaid. You can be anybody from 18 and up. You can be 18, 20, 50, as long as you meet the income requirements. So if you don't make more than $2,200 a month, you may be qualified for Medicaid. So you have to ask. And then, of course, women get a special Medicaid during pregnancy. Also, Medicare, which a lot of people get it confused. I have Medicare. I can go to the nursing home. No, you cannot. You go for short term. They will keep you the first 20 days. From day 21 to 100, you will have a copay. And it's not cheap. It's about $250 to $300 a day. And after 100 days, you don't have any more.
Did you mean a month or a day?
A day.
I want to clarify that. A day?
A day. 250 to 300, depending on the facility and what services you need. A day. Yeah. So that's Medicare. And you can use your Medicaid, because it's income-based, to get long-term care placement in a nursing home. It takes time. It can take 2 to 3 months before you get approved. So what do you do the 2 to 3 months whilst you wait? You will pile up a $100,000 bill, sitting waiting for Medicaid to kick in. And when they get tired of you, they're going to send you back to the hospital. Whether you sick or not, they don't care, because you can't pay them. So the goal is to have some coverage, have some long-term care insurance coverage. And it feels like we are the second generation, because a lot of the people in our community are elderly. They've been here for a long time. Things were different. Things are changing. Most of them, there was no such thing as long-term care insurance. You save your money, you leave, and you die. But now things are changing. We are getting sicker at a younger age. We got people in their 50s needing to go to a nursing home, people in their 40s going to a nursing home. So then how do you go from there until whenever something happens? So if you need resources, there are so many people in the community, and we are going to continue. We're going to take, the next time, we're going to actually break it down, sit on the table, and go through with people. We want to break it down to that level so everybody will feel comfortable to talk about.
So on the Medicaid, what is the income? How do you qualify for Medicaid? What is the income requirements?
So you can apply online, or you can go to one of the Social Security offices, and you better go with everything. When I say everything, everything. You want to go with your pay stubs, you want to go with your taxes for the last 3 years, and they will look. They're going to look and see if you own any property, If you own any vehicle, anything you own, you don't have to lie unless you don't have a social security number. But you do have a social security number, they will find out. Back in the days, people would do a transfer. You give it to your child or you give it to a sibling so the house wouldn't show in your name. Well, they can pull all the way to 10 years and see what got transferred out of your name. I mean, you want the government to pay for your stay, right? Because nursing home stay is not sickness, it's a home. So if you want somebody to pay for your home, can you own a house and have somebody else pay for your house? No, they will not do it. So that's where long-term care insurance comes in.
Very, 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 very interesting. So now let me move to.
I wanted to add
Anita.
one comment.
Okay,
to
go ahead.
The income base. So,
Yes.
I mean, Susie was right on point because when it comes to your asset, you need to be impoverished to $2,000. So you can imagine, lived in this country for 20, 30 years, you've built a lot of wealth. And now you need to literally sell all your asset until you have $2,000 to your name before you qualify
Wow.
for Medicaid. So with that, you always have to be thinking about that because we always think that it's far-fetched, but it's just a matter of when. Because 95% of the time, we would always get sick before we even die. So that is something that we always need to think about because it's a matter of when and not if, right? So just wanted to add that income base as
Very,
well.
very interesting. I hope you're all taking down your questions and get ready to ask some questions. Okay, so my next topic. So Susie was talking about long-term care. So Anita, what is that? What is long-term care? Is it some form of insurance, and why is it important?
Absolutely. Long-term care in itself is an insurance, but it is an income replacement strategy. Although it's an insurance, we tend to be so focused on insurance and we forget about what it actually does. It is a private insurance that cares for you when you trigger a long-term care event. Triggering a long-term care event means you trigger one or two, actually two, of the 6 ADLs, meaning you cannot eat by yourself, you can't walk, you can't bathe, you can't continent, you cannot move, and I believe you cannot, I don't remember the last one, but 6 of them, basic ADLs. If you cannot perform at least 2, you trigger a long-term care. And when you trigger a long-term care, this can come in the form of stroke. It can come in the form of, critical chronic illness, right? So that is when you need that care because you lose money. And your spouse or your family who are supposed to take care of you are also going to lose money because they may have to what? Stop working or reduce the number of hours that they work to stay home and take care of you. So that is why long-term care is really, really important. And yes, it is an insurance. Now, how do you obtain long-term care? And I'm sure that's something that, we always talk about. You can obtain a standalone long-term care on itself, or you can do a hybrid. When you do a standalone, I know people always talk about, well, there's a tendency that if you don't use it, you lose it because it has a timeline. But when you do a hybrid where you can now, use it as, have a rider on a life insurance policy, for instance, you know that you have 2 benefits. If you don't use it, you have a benefit of what? Life insurance. If you use it, you do accelerate the life insurance benefit. So that is a great option to obtain a long-term care.
Interesting. So on the long-term care, from what I understand, kids can get it as part of the life insurance. Can you expand a little bit on that?
Absolutely. Typically, long-term care, you have to be 21 years old and over. So although kids can have life insurance for the rest of their life, once they turn 21, it is imperative and it's very important that we do a policy review and now add the long-term care benefit to their plan. The great thing is the plan is already in force. And as long as they qualify through, they are going to run their medical record to make sure that they are not a high risk because long-term care still goes through medical underwriting. So they are going to run a medical record, medical check to make sure that they are okay. And yes, by the time they are 21, God willing, they are great. They are in good shape. So why not? We just have to go ahead and do a review and add
And
it
whatever
on.
they pay at that point, it doesn't change, right?
It might change slightly.
Okay.
It might change slightly. Typically, long-term care as a hybrid approach with your life insurance costs less than a typical standalone long-term care. So it will cost slightly, but it's not that much. Sometimes the difference you're looking at is about $7 a month between whatever you are paying for your regular life insurance and the long-term care delta. $7 all the way up to $30 a month. But it's a great benefit to add to any form of life insurance.
Because you never know. And I do understand, and I found out this out yesterday, there's a couple of states are mandating long-term care. Is that something that we're going to see in Texas? Do you know?
Yes, I can speak on that. So, long-term care is becoming a pandemic for most of the states. So the state of Washington have already mandated their, what's it called? Everybody, as long as you're working, as long as you're over 18 years old, and you are working, now they have mandated a 0.58% tax.
Interesting.
That is another line item in your payroll. So when you get paid, you pay your Social Security tax, you pay all the Medicare tax. Now there's another line item called the Washington Care Fund, and you pay 0.58% on every pay cycle. So with that, the interesting thing is you only have a lifetime benefit of $36,500. So think about
No
it.
matter what your income is?
Yeah, that's your lifetime benefit.
Okay.
You know, we're all going to work at least 30 to 40 years of our lives. So you can imagine working 40 years of your life, paying all these taxes, and your lifetime benefit is 35,000, almost 37,000, right? But even if you look at the numbers, back in 2021, the average private room in a nursing care in the state of Washington was over 127,000 a year. Even if you receive 44 hours of home health care, that is about $78,000. So do you believe that 37,000 will be sufficient for a lifetime? So that is why we highly, emphasize that it's very important that we buy our own long-term care. When this got enacted around July of 2023, the state actually gave, everyone the option to opt out if you have your own private long-term care. Or if you have a period of 3 years before the law came into effect, if you could purchase your own long-term care, then obviously you don't have to pay that taxes. Currently, the state of California has passed it. It's in the House, and they are now going into the process of execution. Many states are tagging along. Before you know, it becomes a federal mandate, and we have to now pay a line item in our paycheck. So it's very, very important we have it. Everybody can have a $1 million long-term care in a life insurance policy, and it wouldn't cost you that much. And even if you have a 2%, elected, you can get close to how much? Almost $20,000 a month to take care of you, month in, month out. So why not?
Very interesting. Dr. Max, Susie, anything you want to add to that before we get to the questions? Anything you want to add? You good? All right, we're going to move into questions. So for those of you on Zoom, we'll start with Zoom and then we'll go here. Do we have any questions from Zoom? Not yet? All right. Ivan, can you walk around and see whether anybody has any questions? Anybody has any questions, just raise your hand and...
Yeah. Thank you for coming. I would like to know on the long-term care, if the states impose this new, law where individuals will be, money will be taken from their paycheck, what happens to people who are already retired? How are they going to get into that system?
Well, if you're already, sorry about that. If you're already retired, I'm sure by then you would be on Medicare or, of course not Medicaid, right? But Medicare. But as far as long-term care, you're on your own. You are pretty much on your own, right? I mean, there are other state, funding, right, that you can get. But as far as, specific to retirees, that is something that I would have to look into further and provide more details. But pretty much you have to have funded it. And there are exclusions. Exclusion is if you don't fund it, you don't get it. If you don't fund it, you don't get it. And also, if you're self-employed, you don't even qualify. There are exemptions. If you're self-employed, you don't qualify. You have to be self-employed for at least 3 years, and they give you the option to, be able to fund it. So that's the understanding.
Any other questions?
Yeah, I have some comments to make. For those of you who live in within Harris County, if you don't have insurance or the money you make is not that adequate, there's something they call the gold card. And the gold card gives you the opportunity. You have to apply for it, and once you get it, you can go to some of the community or county hospitals like Bentop or LBJ. It doesn't cost you anything. If you make a mistake, you're not sick, you don't have insurance, and you go to one of the private hospitals, they're going to slap you with a very, very big, bill. So this is something that I tell most Ghanaians that they should be aware of. They have, Bentop, they have LBJ. Sometimes Ghanaians have misconception that, because it's a county hospital, they don't get the same quality of care. No, like Dr. Edulate said, they have, attending physicians who are specialized, who can take care of everybody who comes over there, although they work in conjunction with the resident. So remember that. I don't know about Fort Bend or the other counties, but I think they do have something similar. But I know in Harris County, it's called the Gold Card. And it's incumbent on all Ghanaians, if you don't have insurance, to try to apply for that. If you live in, within the boundaries of, Harris County.
Is there an income requirement for that, or
I don't know whether there's any income requirement. I think the most important thing is you have to live within the boundaries of Harris County, okay? And you have to apply for it. I know there have been some few Ghanaians who have referred them, and they got the gold card without any issue.
awesome? Here we go.
I have a little to say about the Fort Bend issue. I happen to work with Fort Bend County Health and Human Services, and unfortunately, we do have free services, but unfortunately, we don't have hospitals. We only have our clinics for immunization for the children, and we also have for adults. We have what we call the CCP Charity Care Program, where you can be enrolled and have free immunizations, and also we have free HIV, STI services. So unfortunately, we are not big like Harris County. We don't have the hospitals. We only have our small clinics.
Good information.
Yeah, I was going to ask if the gold card pertains only to senior citizens, like the retirees.
No.
No,
Anybody?
Everybody.
it applies to everybody.
Oh, okay.
Children and elderly and everybody.
All right.
And also for Fort Bend, even though they don't have a gold card, there is a clinical Access Health. It is same way, income-based. You go in, do the screening. They have every specialty. I've been there. Every specialty, including surgery. So please use it if you're in Fort Bend. If you're in Montgomery County, you can use one. It's right here on 45 and Oak, what is it? Oak something. It's called Interfaith, I-N-T-E-R Faith. Interfaith. They have everything, and if they cannot have your specialty, they will give you a free referral. You can have a whole surgery done. They have ophthalmologists. They have everything. So you use those resources. If you're in Montgomery, Interfaith is a good one.
I also want to add something. So we've said a lot about insurances. So what happens to somebody who doesn't have insurance and they have an emergency? you have a broken hip. Your mom came from Ghana or somewhere, and they have a broken hip, a broken back, or heart attack, or some kind of emergency. When an emergency happens, the last thing to think about is insurance. You can go to majority of the hospitals around here. They will take care of the emergency. And then through the social workers in the hospital, you can apply for whether the gold card or the Medicaid or Medicare or some kind of charity program whilst you are in the emergency. So don't think, oh, your mom came here, they broke your hip, and because you don't have insurance, you sit your mom at home and, like we say in Ghana, bully the hip. Massage the hip to get better. Please take them to the emergency room, please. They will offer service. They are required to offer service in case of emergency. So please.
All right.
Can I add something?
Yeah. I just want to, because we're talking about insurance, if you can explain a little bit about Obamacare and what is it? And my second question, because is on the long-term care. Like our income is not enough to foot the regular everyday expenses, and you're talking about getting long-term care. How much? What does it cost? What are we looking at?
So Obamacare, which is the AKA marketplace insurance, you can buy your own. You go online, just type in marketplace, or even type in Obamacare, and you Blue Cross have one. My personal blue plan. You see all the options. It tells you how much you pay a month and how much your co-pays are gonna be. So let's say you're paying $80 a month, but your co-pay for every visit is $100. If you don't get sick and you only get sick once or twice a year, maybe it's okay. And then you can have another marketplace where your co-pays are $120 a month, but when you go to the doctor, you only pay $25. So you get to compare all the options. You can compare 5 options and select what you need. So it all depends on you. But yeah, go to the marketplace. You have, most of it will be answered. United Health has one. Blue Cross has one. Cigna has one. Everybody has one.
Yeah, that's a good point, and I can touch on the cost of long-term care. So, yeah, we hear that all the time. Hey, I have all family commitments. But like I mentioned earlier, if you plan and try to do a hybrid plan, it wouldn't cost you that much. But also, you always have to have the end in mind, right? When it comes to costs, the one thing I always mention is in the absence of value is when you see cost. It will cost you no matter what. In case you trigger a long-term care, it's going to even cost you more. When it comes to the cost of insurance overall, you are actually paying a penny on the dollar in the event of to receive the dollar. So it all depends on your suitability and affordability. You don't have to purchase $1 million if you cannot afford it. You can purchase as low as $100,000. And $2,000 a month is it's still something. It might come in to help. You can purchase $500,000, and it wouldn't cost you that much in long-term care costs that is embedded in your hybrid plan. So it's all about suitability and affordability. Why suitability? You have to consider long-term care as an income replacement strategy. So if you currently bring home $5,000 a month and you trigger a long-term care and you are no longer getting that $5,000, how are you going to take care of you and your family, assuming you are the breadwinner? So those are the things we need to be thinking, and that is the value it brings. When you see the value, now it's not even about cost, right? The only time we don't see value is when we see cost. And that is why we need to approach it as an income replacement strategy. Because if you start getting that $5,000 coming in monthly, it doesn't feel like you've lost money because you just put a penny on the dollar in the event of.
Okay, so you're trying to say that the long-term care is not just for the hospital, but it brings money into my pocket. Is that correct?
Okay, David. So, long-term care insurance covers for you to stay, or let's say you want to stay home. You have a stroke, you're 50 years old, right? Life still goes on. You need a caregiver. You can't get up by yourself. You can't make it to the bathroom. So if you have that insurance, you have an option that I want to stay home and have my wife as a caregiver, right? They're gonna pay you. First of all, they're gonna do an analysis and see how much a caregiver will cost per day times 30, and that's how they determine how much money you get a month. So even if your wife is your spouse, yes, but they're not working to take care, just to take care of you, that cost will come to you. However you divide it, that's your problem. Or you can choose to go to a skilled nursing facility, aka nursing home, right? Whatever the nursing home charges, that long-term care insurance is gonna pay them to keep you there and take care of you. So the reason why she say it's money in your pocket is you have an option if you want to go live in the nursing home, right? Or you want to live home. But you will get that money in your pocket. Is it helping? Like this is, let me give you a typical example. And this is a real life situation.
I think you got to give examples.
Real life situation that is going on this week as we talk. We're not even finished solving that problem yet. This is a person, maybe 70s. I had a stroke. In the last 7 days, been through acute care hospital, which is a whole different day. We'll break down the different transitions in care. Left acute, and then they said, oh, well, what do we do, Susie? Well, you need to go to rehab, right? Because now you can't walk like you did last week. Well, what does it entail? We only have one insurance, yes. So now you can either go to acute rehab or they will take you to a skilled nursing home with rehab. Right? So now we are in skilled. In the next 2 weeks, the skilled days are up. This is reality. They already approached, the office approached the spouse and say, this is how much it's gonna cost. What is your plan? Do you have a backup? She said, no. She started calling around. Is that how it works? I thought Medicare is gonna pay. No, Medicare does not pay for you to live there. And she said, I cannot take care of him. I can't take him home. What do I do? You gotta wait till Medicaid kicks in. 60 days, they're gonna be going through everything you have. The 60 days, you're gonna be paying somebody, right? So that's how it works. So now you have an option, take the person home, care for them, or stay in the nursing home and use all your life savings.
And just to add quickly to that, so when I say it's an income replacement strategy, you still have your health insurance, but health insurance is not covering for your long-term care expenses. You know, all the extra costs that health will not cover, right? Medicaid, we talked about it. It would cover the first 20 days at 100%, but, you know, the remaining 80 days, it has significant copays. It's not going to cover for, and think about the recovery. Let's say I get a stroke, and the recovery journey is 7 years. Do you think 100 days would cover for my expenses? Possibly not. In the same manner, Medicaid, you have to be impoverished. You build a lifetime of, you know, assets, and just because you're sick, you need to sell all your homes, you need to sell all your cars to be impoverished to $2,000 before you can receive that assistance. So
this is real. This is real.
It is. And then people also have the misconception about short-term disability and long-term disability. They are totally different from long-term care. Short-term disability is, we typically get it at your employer. It replaces your income. It's also an income replacement strategy. It replaces your income in the short term. Every company is different. It can be the first 12 weeks. That's 100%. And then when you go on long-term disability, now it's reduced to either 60%, 70%, or 80%. First of all, if 100% of my income is not enough to cover for my everyday expenses, do you think 70% of my income will be enough? And for how long? right? Triggered a stroke. My recovery is 7 years. It's not going to last. And it's only up to a certain point that you are no use for your company. And you are, on your own. Right? So long term, it's another, money that comes in to care for you, even if you have life insurance, even if you have health insurance. So-
Maxwell, you wanted to add something?
Yeah, so majority of the time when we hear people speak, including myself, we think, oh, this is something that's out there, or this is something that,
won't happen to me.
It won't happen to me. But as I sit here today, I can say 20 years ago, my uncle in Oklahoma had a stroke. He was an engineer working everything. He had a stroke 20 years ago. Thank God to his long-term care. Initially, he went to acute rehab and then the choice is to go to nursing home. But as a health professional, I can tell you, as these ladies will tell you, as Dr. Majite will tell you, staying in the nursing home decreases your chances of survival or long-term health. So that insurance allowed him to stay at home for the wife to take care of him. This year, we celebrate his 70th birthday. He's doing way much better than he would have done if he went to the nursing home. But also, because of that insurance, it allows the wife to quit the job to stay at home and take care of him full time. So, I mean, we always think these things happen to somebody else. It's not me, but it happens in our community.
Yep.
Wow.
There's a question in the back.
Yeah, before we get there, I think you've answered this question, but this is from online. It says, if you have Medicare plus A or B, do you still get long-term insurance?
Long-term care insurance, yes.
Yeah.
So Medicare A and B pays for your hospital stay and your doctor's visit. It doesn't pay for long-term living permanently in a nursing home. Is that
Yes.
answering the question?
Yeah.
Medicare A and B pays for hospital. It will pay for your doctor. It will pay for the building, the hospital building. It will pay for rehab. But after that phase is finished, it doesn't pay for a room and board. That's what we call it. When you're in the permanent nursing home, you pay room and board. Houston, 8 to 10,000 average. When I say average, I mean average nursing home. I don't know how many of you have walked into a real nursing home, but average nursing home is no place to joke. And that's $8,000 to $10,000 in Houston. If you want to be in a nice one, you're looking at around 12 to 15, and then you go to the premiums.
Wow. So, do you have a question back here? Yes.
I have a little attempt to, David, just take it this way from what they said about it being money in your pocket. Let's assume you have all the money to pay for it. So you didn't have that long-term stay insurance. Because you are that rich, you are going to be doling out that $5,000 a week or whatever they call it to pay because you didn't go for that insurance. And you are rich.
The man will finish.
You are still rich, but you have already signed up to that investment, that insurance. That $5,000 that you'd have been visiting your your savings for, the insurance kicks in to pay, so that money stays in your pocket. Are you okay?
Okay, one question from the back, and then we'll move on to topic number 2.
All right, thank you for the opportunity, please. So I wanted to ask, what role do advanced directive, living wills, and power of attorney play in the long term?
We'll get there. Could you hold on to your thought? We'll get there. That's on a different section.
And a quick add-on, if you're not sure what a typical nursing home looks like, we have one coming up next week. Come with us.
Yep.
We'll go see it together, David. So then you can make a decision. On the 5th, yes.
All right,
September
so...
5th.
And Joe, just to quickly
Yes.
add on the real experiences. So my oldest daughter, during high school, she got the CNA certification whilst, going to college. She was working as a CNA. And I know in our community, we do have, home health care aides in our community as well. So she was working for this, family, and they live in, I'm talking about a mansion and all that. And This lady is being taken care of at home. Now the question is, how are they managing that care, 24-hour care? She goes in 8 hours, somebody comes in, relieve her 8 hours. So you ask yourself, how are we able, that is the same money they used to pay us to take care of them, to go do grocery for them, to, take them to the hospital. This is long-term care. Meanwhile, they are not depressed, and especially if it happens whilst you're young. So just so you know, 37% of people who trigger long-term care are under the age of 65 years old. So it's not even for somebody who is 70 or 80. And that is why we have to reconsider getting a long-term care.
All right, so we're going to move on to wealth. And, personally, I've been in corporate America for 21 years. And one of the things that I always advise people is you have to save for your retirement. I know there's a lot of folks who like to see that paycheck, right? They don't want to save. They don't invest in 401k. They don't do any of that. We have some people who have businesses. They want to see that paycheck, but they don't think about their retirement. So I want to tackle the whole issue about 401k and savings. Why is it so important to have a 401k? And then we can talk about the difference between 401k and IRA.
So, sorry to interject here, but I need like 5 minutes. So I know we've talked about we're talking about health, and we talk about long-term care, and everybody is scared and about to crap their pants. The question is, how do I prevent myself or from getting to that point where you have disability or can't take care of yourself or end up in a nursing home? There are ways to stop that. There are people that are 60 and have bad health, and there are people that are almost 100 and living by themselves. How do we get to the point where we can cross that second half of our life healthily? So, few things that we mentioned earlier. Please do your checkups. Checkups.
Do you recommend once a year or twice a year?
So it depends. It depends on something with your primary care doctor. Some women have to go see the OBGYN once a year. Males, depending on your age, depending on what health care or what medical issues you have. So that depends. But we all know that women have to get their yearly checkup. Men, we have to do prostate because that's our dangerous thing. For years, I myself, I was scared of the prostate exam because nobody want to hear that you have to get a rectal exam. But luckily, there's a new guidelines. Now they check your PSA, which is a blood work, and if your PSA is normal, you don't need a finger anymore. When I went to go see my urology, my wife was excited, thinking I'm going to get my finger exam. But when I came home and tell her, oh, guess what?
She was disappointed.
I didn't have to do the finger. She was disappointed. But at the same time, she was happy I went. So the PSA test as well. Now, musculoskeletal, which is what I do, the most important thing. How many of you here above 50 can do a single pull-up? Meaning you grab onto a bar and pull yourself up. If you can't do a single pull-up, 50, 60, or 70 above, certain things you can't do a single.
Do you have a slide? Could you put that slide up?
If you can't do a single push-up, those things will affect you. All that muscle strength you gained when you were in Ghana or when you were in your teen age is what served you up to this point. Now we're in the second stage of our life, with the second half, or whatever you want to call it. Okay, above certain age, 40 or 30 or 50, you are crossing the second stage. And in the second stage, you need to prepare now for that second stage. There are 90-year-olds that have not had any hip fracture. But I see hip fracture all the time because at that age, if you don't have that muscle strength, you won't have the stability to walk around. You fall out of the shower, you break your hip, and then you have to worry whether you have your long-term care or not. So how do you prevent from worrying about nursing home or long-term health? Please get your muscle in tone. Whether you start working out today, build your core. We all grew up in Africa where we carry buckets in our head and all the stuff. So we are prone to degenerative diseases of your spine. You don't want to end up walking like this in your 70s, 80s, and everything. And trust me, it happens. This is the time now that you have to build that core muscle strength for the next second phase of your life. So don't be scared and start thinking, oh my God, we all going to die. We all need a long insurance. We all need nursing home. No, there are people out there. My grandmother is 95, and she's not in a nursing home. Thank God. But she's able to walk. She can get in the car by herself. Those are the things that you need to build that muscle strength now for the future.
Awesome. But you never know. So you need to protect yourself.
Oh, yeah, definitely. Definitely.
All right. So moving on to 401k. And I'll tell you, I've seen a lot of people, especially those who do contracts, and a lot of people just choose not to invest for their savings. So could you talk a little bit about 401k? And then we'll get into the differences between 401k and IRA.
Absolutely. So 401k in itself is a tax plan, right? It's also a retirement plan. 401k is the same as IRA. So I know you were going to talk about that, but it's the same as IRA. 401k is the employer-sponsored IRA. So your company is sponsoring that. What typically happens is you put a certain amount down, your company decides they're going to match you a certain amount or a certain percentage. So those are all the things you need to consider. 401k, it's great because it is a tax-deferred vehicle whereby you put money in there, it grows tax-deferred, but there are so many considerations you need to consider because number one, you want to consider if your company is matching it. Number two, you also have to consider how much are they matching you. And then you need to also consider how much you are going to contribute into and also consider your tax bucket, right? So that is 401k in simple terms.
And okay. So what about, go ahead.
401k and 403b, they are the same thing. 401k is for, for-profit companies. 403b are for the government, and we have TSP, 457. They are just different tax code names for the type of plan. So 401 is for for-profit companies. 403, 457, TSP, those are government and federal and education and hospitals.
It's like the 401ks are matched, it's incremental, but 403b is just like a savings, just that they invested in, the stock market. So to me, I think we should prefer the 401k to the 403b.
So that is where I did mention that you need to consider whether your company is matching it or not, right? So, when we talk about all these codes, 401, 403, even Roth IRA, they are all tax codes in the Internal Revenue Code. And it prescribes how taxes will be treated. So if your 403b or even 401k is not being matched, you have the option to do Roth IRA. Because Roth IRA, you are putting after-tax money in there, it's growing tax-deferred, and you're going to access the money tax-free. So when it comes to these type of investment or retirement plan, it's important to know, the tax impact on your money. So always know whether you are within a tax-deferred bucket, a tax advantage bucket, or a tax now bucket. And when you have the end in mind, meaning, do you want to keep all your money or just some of your money? And that is where you start. If you want to keep some of your money, then obviously you can put money in places where you are going to be fully taxed, right? But the reason why that I always encourage everyone to do 401k is if your company is matching and you are not doing it, that means you are leaving money on the table.
Yep. Absolutely.
So for instance, let's say you make, for numbers sake, you make 100,000. and your company is saying that they're going to match you 6%. If you put 6,000 in your 401k every single year, your company gives you an additional 6,000. That is free money. But if you do only 3%, guess what? You are leaving 3,000 on the table. And some people also don't even know about it, so they don't do it at all. So if you don't do it, you are literally leaving money on the table. So for me, that is the first conversation we are having. Is your company matching it? How much are they matching? And how much are you contributing? And that can be a little bit sticky because people really don't know how much you're contributing. They just tell me, okay, hey, I put $500 down. The question is, what does 500 represent in percentage? Does it represent 7%? And if it's 7%, how much is your company matching? If your company is matching only 3%, then that means you're putting so much money out there to be taxed in retirement, in your non-income producing years. So for instance, and if your company is not matching at all, then that is not the best place to start. If 403B is not being matched, your best option will be your Roth IRA, because you put everything in 401, 403B, it's not being matched, and at retirement, that money becomes $1 million. That 100,000 becomes $1 million, and you are within a 30% tax bracket, for instance.
30%. Yep.
You are giving Uncle Sam 300,000 of your $1 million in your non-income producing years. That is when you're no longer working and not bringing money in. And folks will always ask, well, I'm not making money. How do I get taxed? Wrong. You get taxed on how you distribute your money, not whether you are working or not. So let's say you have monies in different places and you are distributing that money to you. That is how you get taxed. So again, it all depends on the individual and the company, and of course the percentage as well. And consider taxes.
Yeah, I think what you said was very important. And being in corporate America, I always tell my employees that if you want to leave the company, go work for another company, don't get excited because you're getting $1 raise or $2, so you're leaving. Look at the whole package. Look at the benefit. The pay might be a little bit lower or the same, but for your long term, the kind of benefit that certain companies have is what you got to look for, right? Some people offer, you have a baby, you're out for 12 weeks, 16 weeks. Some people, 1 week, you better get back or they'll replace you. I'm serious. So, when we're talking about wealth and making decisions, if it's a $20,000, $30,000, $40,000 difference, yes, but you have to look at the entire package benefits, because you know what? You got to be thinking about your retirement. So I'm glad you really explained the matching piece, especially because some of the companies really do match very well. Anything, Maxwell or Susie, you want to add to this topic? All right. So I'm going to move in. Do we have any questions before I move on?
Yes.
Yes. And do we have any questions online?
Thank you. I think 401k is very, very important because there are some companies, they don't do it. Because I worked for a company, an engineering company, for 10 years, and they were not doing it. And I have to fight with them every day because I was fighting with them. So I decided to quit. And I joined another company. Now one of them called me, one of the engineers told me that they've started. But when I left to the other company, I worked for them almost 10 years. When I look at my 401k, what I have in the match,
exciting.
It's exciting. So I will advise each and every one, as Joe said about the package, it is very, very important. Just look at it. Don't just jump because you've got a raise or you've got a good money. But the package is more important. Your end is always about the end, not the beginning. Thank you.
Just to add a little bit to what he said, companies are becoming very, they are enhancing their packages as well. Back then, we used to only have the 401k, but these days they have the traditional 401k and they have the Roth 401k. So you see, it all depends on what the company is offering, what you are contributing, and then you can make that, and how much you're contributing, and you can make that decision. So some companies will say that, okay, hey, we will match your 401, your traditional 401k, but we will not match your what? Your Roth, your 401k Roth. Some companies will say that, hey, it doesn't matter where you put your money. We are going to match you up to 6%, whether you put it in your Roth IRA or your Roth 401k, or you put it in your traditional. So these are things that are very, very important to make that decision for you. Because, for instance, if the company is matching no matter what, I'm going to go with Roth 401k. Because Roth 401k is where I know I'm not going to be taxed. So all that $1 million in retirement, I'm taking it home tax-free. But again, it all depends on your company. So very, very important you assess the company's
And look,
guidelines.
And look, a lot of the companies, the 401k, you can borrow out of it. You could have an emergency. You could borrow out of your 401k instead of going to get this big loan, and then they'll take it out of your paycheck, right? They'll extend it. You probably won't even notice. So it's very important because you never know when you have that emergency. Okay, yes.
Okay, Anita, you know how you talked about the Medicaid, the criteria for qualifying for Medicaid. You have to be impoverished up to $2,000 in your pocket. Now we're talking about the 401k. I know that there is a maximum age, or an age where one has to get to be able to reap out of that. Now, let's say somebody started working at a very young age, and probably they were fortunate enough to get good income. So they have so much in their 401k. And then they fell sick at a young age. Because these days, people at 40, 45, 50 are having strokes and, terminal diseases. A person like this, okay, who probably may or may not qualify for Medicaid, or let's say even a 60-year-old, and still they are not at the age where they can reap from the 401k, okay, so they cannot apply for Medicaid, right? Even though they are 60, is the government looking at these people to be impoverished even as to wiping out their 401ks? Because they wouldn't be at the age where they can reap from it. You understand what I'm saying?
I do. I do, and that's a good question, and I think it's a two-part question. Number one, can you even access the money, right? Whilst you are, yes, there are some exclusions.
Correct.
Okay.
If you are really that sick, then yes, they would allow you to access the money.
Without a penalty?
Without
Yes.
a penalty.
Okay.
Yes.
If you're really sick,
Okay.
you can access the money. But if you're just taking it out before the age 59 and a half, that is where you pay your the federal penalty,
Right.
and also have to pay taxes on it. But even with the Roth, which we are talking about as tax-free, it's still not free, right?
Yeah.
You can access your contributions up to how much you put in. But the growth and the earnings in the Roth 401k or Roth IRA, you cannot access it until 59 and a half. If you access the earnings, so I put in 100,000 and maybe, it's 200,000, I can only access 100,000. That extra 100, even though it says it's going to be tax-free, the code says that you can only access it when you are 59 and a half. So you cannot access the earnings. So there's so many exclusions, pros and cons, but it's still great because I have money earning tax-deferred, growth, and still can access it. Now, the other question of RMDs. Yes, all the plans, as long as it's a tax plan like your Roth or whatever, they have RMDs. Uncle Sam needs to be paid, right? Uncle Sam says, okay, hey, I'm helping you to save money till age 60 so you can start withdrawing. The moment you turn age 72, if you don't start taking money out, we have something called RMD, right? Which is the required minimum distribution. If you do not start taking that money out, Uncle Sam is going to tax you a hefty penalty. Prior to 2022, it was 50%. Secure Act 2.0 made some law changes, and now it's 25%. That is, if you have that money saved up and you think, oh, I'm banking it up forever, no. They want you to start withdrawing money out of it. And they have a required minimum, so that's why they call it the required minimum distribution. So based on different criteria, different calculations, you are supposed to be taking a certain amount every year. And if you don't take that, now you're going to pay 25% penalty.
Is it
So,
cross-gender or for men, or
I'm sorry?
is it for both gender?
Oh, absolutely. RMDs are for, as long as you have your money in the tax plan, you have a required minimum distribution tax if you don't take it beyond age 72.
Okay, I have a question, if I'm allowed. Quick one, just what you just said. So, at age 72, I'll be required to take some of the money or have a penalty. Okay, can I be smart enough to withdraw from there and put it in another account?
Absolutely.
Okay.
Why not? And
Your money.
absolutely. So, I know someone mentioned about, like, I'm working at one place and maybe I've accrued a lot of 401k and I left the company. Don't leave your 401k there.
Okay.
Talk to your financial professional, talk to your financial consultant. You can actually turn that into a self-funded pension. Whenever you are in your current job, you really can access that money. But whenever you leave, and I come across so many people who have worked 2, 3 jobs, and they have their old 401k sitting there. If you are not in that company, why is your money sitting there? You can roll that money over into a personalized pension, and it can give you a lifetime income for the rest of your life.
Okay, and my second question, like I said earlier, I work with Fort Bend County. So I'm on the Texas County and District Retirement System. Yes, how does that play out with all this 401k and the rest? Where do I stand?
That would fall under TSP, I believe. Is it a TSP? That would typically fall under TSP, and TSP is also falls under the same category.
What is TSP?
So those are like the government retirement plans, right? It's just the same as 401k, but
Is it enough? And if not, how do I augment that?
That is why you need to have
save more.
diversified portfolio, right?
Yes,
Diversified portfolio. So always remember there are 3 tax buckets that you always have to put your money in: tax now, tax later, and tax advantage. Make sure you are diversified so that if you need emergency fund, don't go interrupt your investment, right? Put them in a liquid account that will give you a good rate of return, but you can still have access to it. So you should always consider liquidity, long-term investment, but also think about the end in mind. Do I want to keep most of my money or just some of my money? And that is my number one question. If you start with the end in mind, now we can backtrack today and figure out where you are putting your money to achieve that financial goal.
I think we have a question online. Somebody on Zoom has a question?
I have a question.
Yes.
Can I go, Anita?
Yes, go.
If I have 2 jobs, Anita, can I, and they both offer the 401k, can I enroll in both companies on the 401k, or I just have to have one 401k?
No, you can enroll in both, but you always have a cap. Roth 401k will give you up to $7,000, and the regular 401k currently is about almost $23,000, right? So you always have a cap. So hey, depending on how much you contribute, as long as it gets to the cap, that's the maximum you can contribute. Even if you contribute more and they deduct more at the end of the year, you'll start seeing that your paycheck is increased, and you'll be wondering, why am I getting more paycheck? It's because you've met the cap. So yes, you can do both, but as long as you meet the cap, that's the maximum you can do. You cannot do anything more than the cap. But there are different solutions out there that you can overfund plans so that you are not limited just to your 401k, right? So when we talk 401k and the Roth, I always say that think about Uncle Sam. Uncle Sam has given you a bigger bucket in 401k, almost 23,000. But with the Roth, it's only 7. Why? He's not going to tax you. He's not going to get any money off you on the Roth when you retire. So that's why they give you a small bucket. But with the 401k, they give you a bigger bucket to fund it so that they also get their pro rata share. So it's all about you, not even Uncle Sam. It's all about your goals, right? So yes, you can contribute to 2 plans. As long as it meets the cap, that's where it is.
Awesome.
Gotcha.
All
Okay,
right.
thank you very much.
You're welcome. Okay, last question. before
Joe,
we-
question for me.
Yes, go ahead.
Joe,
Go ahead.
again, this is to Anita. You mentioned something about converting your 401ks when you leave a company into a personalized pension plan. How does it work?
Well, we can talk about it, but they are what we call annuities, right? We have income-based annuities. We have growth-based annuities, and there are some great companies out there that would even give you bonuses. So let's say you have 100,000 from your old 401k. I work with a company that would actually give you a 40% bonus if you want to do an income annuity, meaning you pull that money, roll it over into an income-based annuity. They offer you that extra 40,000. That money grows. Of course, it's going to grow steady. You shouldn't expect quick swing, but they also give you a floor rate where you never lose money because you're using it for income. And then in retirement, it systematically becomes income for you for the rest of your life. Even if the growth goes to 0 and you have depleted it to 0, the insurance company is on the hook for giving you a lifetime income. So that is how you can supplement other sources of income. If you have an old 401k, you don't leave it there, because when you leave it there, and I see that people also liquidate it. You do have the option to roll it over, and when you roll it over, you are not liquidating that money. You are not paying taxes on it. It's coming in tax-free, and the money is growing tax-deferred. And then when you start taking income, of course, you did not pay taxes on it throughout, but if you start taking it in small chunks, you notice that I'm not paying a bigger tax amount, right? So it's still a good tax strategy if you roll it over into an income base or growth. Depending on your age, if you are younger than 65, I would not, recommend doing a growth, because you are 65, getting into your retirement age, you want to start taking money out. But if you are younger than 65, that is where you can do a growth annuity, whereby you get the opportunity to get more, bonuses. So depends on the contract. It could be 7 years. It could be 10 years. If I'm 50 and I put it in a 7-year contract, after 7 years, I get another opportunity to what? Grow it again and still get another bonus and grow it again until I get to retirement. So it's, like I said, it's just based on your own goals and financial plan. But yeah, there are products and great companies out there that you can roll your old 401k into.
All right,
Tax free.
Okay.
last question. We need to move on.
Okay, my question is this. If you happen to work abroad, and then the company you work with, you had a pension plan with them, and now you are here in America working for another company, can you transfer or roll over your pension from that country into your 401k here?
Well, I'm not 100% sure about foreign companies, right? Because these old 401k and all that is all under the U.S. IRC, Internal Revenue Code, right? So we would have to understand what those laws are in that country and kind of do reciprocity, figure out where that plays into the U.S. Internal Revenue Code. So I'm not 100% sure, but we can look into it.
Thank
All
you.
right. Okay, we're going to move on to legacy.
Joe, I have a question for her, please. Just one
Okay,
question.
please, real quick.
So on the 401k, I realized just recently that even though it says under hardship, you can withdraw under hardship. When you withdraw it under, let's say, maybe you have a funeral and you need some emergency funds to add to what you have, it's 30%.
Right.
But when you withdraw under, let's say, I just found out my son was going to school and I needed some money in addition to what I had, and I withdraw just a little, and that was 10%. Why?
Well, that's what the code prescribe, right? So this is where we talk about and I know that a lot of people may not necessarily be familiar with the tax laws. And when I talk about all these numbers, 435, 529, 457, every code has so many laws under it. And even as a financial consultant, believe me, I don't know all the code in the Internal Revenue code, right? But only what I know that, again, with what I do, I can speak to. But of course, they are all prescribed under the code.
Thank you.
One thing I'll tell you is, even though you might say 10%, you better save 30% before you take that out, because at the end of the year, Uncle Sam, you might end up paying some taxes. So you just got to be careful.
And just to quickly add, when you also, besides the hardship, right, you did mention that you can loan, right? Mm-hmm. When you get a loan, don't think it's a free loan, right? Yep. You still have to pay back. Right. It will be deducted from your paycheck, right? Yep. So you may not feel it, right? It's from your paycheck.
But
if you leave the company, it becomes a taxable income.
Absolutely. But things like down payment, you can actually get a down payment from your 401k if you're buying a house. So there's a lot of benefits that go with it. But we're going to move on to the third topic. And you know what? This is very personal for me, because yesterday I was emceeing at a funeral celebration of life. And whilst I was emceeing, I got a text message saying 2 members of our community died. So here, as we are sitting here, we've had 2 people, dead bodies in the fridge, right? And so this topic is very important to me, your legacy. So you think about, a lot of people don't think about things like POA. So let's start with the POA piece, right? Why is it important to have a medical POA and a financial POA on file? Because a lot of times when you start talking to people about that, they say, hey, why? You want somebody to steal my money, or you think I'm going to die? But I really want to get into this topic, and then we'll move into the will and estate. So, Susie, you want to start with that?
Yes, I will cover advanced directives and medical power of attorney, just medical. So anybody have advanced directives here? I know Dr. Majid probably have one.
What is it?
Advanced directive. So this is what you are telling your healthcare staff what to do for you. This is your instructions to your healthcare provider. I don't want you to do chest compressions on me. I don't want you to put in a feeding tube if I can no longer eat. I don't want you to cut off my leg even if it's dead and hanging up. You are giving instructions to your healthcare provider. So, what happens if you don't and you're in a car accident or anything? Guess what? You're going to have 2 random people, don't know you, don't know what you believe in. It could be me and Dr. Max or Dr. Majidi or anybody, David, and we're going to make that decision for you. By knowing you in less than 10 minutes, I'm going to decide, you know what? Let's just cut it cold, right? So you need to have one in place. Anybody over age 18, do you know that if you have a child that's 21 and they're in the hospital for emergency, they can deny you as a parent to make a decision? They can, if they want to, because that child is an adult and they don't have advanced directives. So it is that serious. Please write down what you want. So advanced directives is a state-provided form. It varies from state to state. It is very easy. You can Google on your phone. Just type in TX, Texas Advanced Directives. You will pull the state form. There will be people trying to sell to you. Don't do that. Look for TX HHS, Health and Human Services, Texas. Pull the form. In fact, I have some copies here. Buddy. I have two of them. I have the medical power of attorney and advance, so separate them. Pull it up, 3, 4 pages. Do you know how easy it is to do it? You can do one sitting here. You need 2 random witnesses unrelated to you. They cannot be related by blood nor water. It cannot be your child. 2 random people. You can go to church and pull 2 church members and say, I want you to witness this for me. All they are doing is they saw you sign it yourself and nobody was forcing you to sign it. That's it. Or you go to the post office, go to your bank, notary, have it notarized. Or you go to your doctor's office, the staff there, they are not related, as long as the staff is not related to you. Go to the hospital, housekeeping, dietary. Those people will witness. We call them to come and witness because they're not providing direct medical care for you and they are unrelated to you. This is how important advance directives is. We all need one, including me, including my parents. I hope my dad is watching because if he never signed, he filled it out and he never got it witnessed, I'm going for him tomorrow morning. But it is very important. We all have one. And these children do a lot of crazy things. Your child can go and say, do not resuscitate me. And they can walk in with a little minor thing. And it's like, wait, what? When did she sign that? You don't have a right as a parent. That's it. And so do advance directives, okay? So that's you giving instructions to your healthcare provider. The second one is the medical power of attorney, MPOA. So this is when you elect somebody to make decisions for you when you can no longer make decisions. So it can be it doesn't automatic default to a child. Well, Texas law, number 1, the spouse. But these days, people walk in with anything and claim, I'm a spouse, the next minute, we in healthcare, we know. And then there's a second spouse. And then there's a third spouse. We face it all the time. We don't have time to be looking for people's marriage certificate. No, we don't do that. So, yes, you need to have it in writing, even if it's your spouse, that this is my first decision maker. Okay, you can elect your children. Please, we are parents. You know which one's going to make good decisions. We do. Some of them, don't just because it's your favorite child, don't make them your medical power of attorney, please. Get the one who is going to make good decisions for you because you're talking life and death. So, and you can elect a friend, you can elect a cousin, a sibling, whoever is going to make, they have nothing to do with your money or anything you are living. They are only going to make medical decisions for you when you can no longer make decisions. So, and you can have 2 or 3 people on there, just make sure they like each other because one will say yes and the other one will say no. And these are real life situations, I'm telling you. I have 2 children, and this one says yes, this one says no, so what do? It happens. So make sure that the 2, if you choose 2 people,
so
make
you
sure.
You can do a primary and a contingent,
yes,
right?
You have the first person and then the second person. So yeah, please, they're passing it around, take a look at it or grab a copy and fill one out and go get it notarized or get 2 random witnesses.
What about the financial POA? Anybody wants to touch on that?
All I can tell you is if any of my parents make me their financial POA, I will spend their money.
All right, just to quickly add to what Susie talked about, the medical POA, and I know she touched on it, but once your child turns 18, and I know in our community, from where we come from, even when you're 25, you're still a child, right? In our mindset, we think you're still a child. So when your kids are going off to college, when they are going off to college, out of town, out of state, make sure you have medical power of attorney. And you have a copy, and they have a copy when they go off to school. That way, if anything happens, let's say we have kids that play football, right? Basketball, whatever. If anything should happen and they happen to be in a critical condition and cannot make decisions for themselves, you have the right to make that decision for your child. So every 18-year-old should have a medical power of attorney. You keep a copy, mom or dad keeps a copy at home, And when that happened, we, use it. And so just wanted to add.
Yeah. So look, the financial POA, and we see it a lot, where if you cannot make decisions that comes to your finances, you have to elect somebody to do it on your behalf, or your bills will not be paid. You know what? There's a lot of these places when you call, they'll ask you a couple of questions. If it's not you, they will not do it. So it's very, very important to have both, and both have them on file, right? Keep it in a safe place where because you never know. We could be sitting here right now. Somebody could go home right now. They could get into an accident, God forbid, and then they cannot. They could be a vegetable. They could not act. So very important. Anything you wanted to add to that? And look, there was one thing that, and I know Max, you're going to touch on it, that I found out, and I don't know whether it's everywhere, but somebody tried to add a POA to an LLC, and they said no, they don't do it. Some people don't do a POA to an LLC because LLC could be different partners, so you can add a POA. And I know Max, so you had a point about that, or no?
Yeah, I mean, just like we said, I think LLC is supposed to be a limited liability company, so usually it's more than one person, even though sometimes it can be one person. But if you want to add a POA, I think it's the best thing if you have your own practice, you have a scope or something where it's just one individual, where you can add a POA to your practice or to your business. I think that's what you're talking about, correct?
Yes.
Yeah. So just to, can we pull the slide up because
Yes.
I have the estate planning, because all the documents we're talking about here, they are all estate planning documents, right? And all of them work.
So before you get that, what is the difference between a will and an estate?
Yeah.
Could you talk about the differences?
We could pull that, right?
Before we get to that, I want us to talk about PODs. I work in a bank, and I know POA ends when the person passes away.
Correct.
So you cannot act on the account.
Okay.
So it's best to have a POD also.
Beneficiary.
That is correct.
Which kicks
Yep.
in when the person dies. Right. There's also a law in Texas that says that if an account is dormant for 6 months, we send the proceeds to the state. Right?
Are you all listening?
So there's a need for you to have a beneficiary. So if we don't get to hear of you and you've passed, the money does not go to the state.
And just to add to what he just said, does everybody here know how easy it is to add a beneficiary to your accounts? Easy. Your online banking.
Very easy.
You just sign on.
Very
There's a
easy.
spot for beneficiary. It's very important because what is happening is a lot of times somebody dies, the family members, including the spouse, do not know the money that they have somewhere else, right? But even if you go to the bank and you're not a co-signer or you're not a beneficiary, you are not going to get access to the money. You got to go through probate and go through a lot. A lot of family members, they give up. So guess what happens to the money? It goes out, right? And so it's very important that every single one of you, either here or online, when we leave today, sign on to your mobile banking or your online banking, and then assign a beneficiary, a POD. It's a beneficiary. And it can't be one account. You got to assign to all those accounts. It's very, very important.
Yeah, most of the time we think if somebody knows that we put somebody in an account, that's an African and Ghanaian mentality. As soon as I put this person in my account, they're going to kill me or steal my money. But guess what? And I might be wrong. Uncle Joe knows. You can put somebody on there without them knowing.
Yep, you can.
You can put your spouse on there. You don't have to go tell them. They don't have to go sign.
Yep.
So I guess my wife will find out today that she's on mine.
But that is I want you all to listen to this piece because this is the legacy piece. We have a lot of people who have died, and there's so much confusion with their will. There's Some people are in Ghana, 2 years they haven't buried them. People are fighting. There's money, but you can't touch it. So think about the life you've built, and then you die, and it's just chaos.
It's not only after you die. We always say, yeah, you die. But if something happens to you, and the beneficiary can take the money out, I know a situation right now in Ghana where somebody has a lot of money in the bank and they are sick, but their spouse can't access the money. Nobody can access the money. And the person can physically go to the bank. They can't sign anything. If you have a stroke, you can't sign it. And because of that, the money is sitting in the bank. And your spouse can't, or brother or sister, nobody can access the money to even provide your own medical care. So, I mean, that's very important.
Yeah. Yes.
And then
You die in debt. That is why you need a life insurance.
But that will affect the beneficiary.
It
doesn't affect the beneficiary.
It doesn't affect the beneficiary.
No, it doesn't.
Okay, in that same sense, what if I pass, they go to the beneficiary, and the beneficiary is also gone?
Well, so whenever you put beneficiaries, always do the primary, the contingent, or the secondary. You can even do a tertiary beneficiary. You can do 3 people, so that because life happens, right? If this person is not there, it goes to the next person. All right, so yeah. And I think I wanted to pull up that slide.
Do you have a slide?
And I
Which
think
one?
it's the same thing we're talking about, the last 2 slides. Yep, that one. So, and we were talking about beneficiaries. And this slide, that's a good justice with beneficiary because, at death, whether you have a will or no will, it's going to go through probate, right? Because you still have to go to probate, and probate costs a lot of money, right? So when you don't protect your estate or protect your asset and protect all your investment, you can pay up to 5 to 15% in probate charges, and that can be hefty. And that is why a lot of people leave money on the table. So as of 2023, if I'm correct, the state of Texas was holding $7 billion in unclaimed property with a B. I'm not talking about an M, with a B. Now, the question here is, do you think this money belongs to the wealthy? No. It belongs to the middle class. It belongs to majority of us. And from time to time, let me tell you what I do. I go in there and put common names like Mensa, Ofori, Opoku, and names pop up in unclaimed property. But guess what? There is a grandchild. There may be a son, a daughter, a nephew in our community needing college funding. But just because their uncle, their father, their mother did not put a beneficiary on their account, nobody knows that they have money sitting in unclaimed property. The good thing about unclaimed property, if you go in and you can prove that you are the next of kin and the real, you should be able to claim it. So from time to time, especially if you have family who had lived here for a really long time, they passed on, just go in and do your own research. So talking about beneficiary, it's super, super important. So when you die without a will or with a will, it will still go to probate no matter what. So make every effort. And if you die without a will, it goes through interstate, right? But there are certain things that does not go through probate, and it doesn't even, whether you have a will or not, it will still go to your beneficiaries. And those are the things that we pointed out here on the screen. Like if you have, let's say, a property that you own with your spouse, that is considered joint tenancy, right? So that, your portion will go to the spouse. But POD, payable on death, what does it even mean? All it's saying is, pay all the balance in my bank account upon my death to the person I named on the account. So I can name my children on the account. They still won't have access to my account while I'm living. But the moment I die, every balance in that bank account gets paid to them because it's payable on death. Do you know how easy this form is? Like Joe said, it's even on your mobile phone. You just have to complete it. Take it to the bank, notarize it, and let them put it on your account. POD. People still don't do it.
To add to that, PODs are not limited by geographical location.
I'm sorry?
They are not limited by geographical location.
Mhm.
Can be anywhere in the world.
Yep.
So your family back home, you can name your siblings, you can name your parents.
Mhm. Yeah, good point. Good point there. But also, life insurance, they don't go through probate. If you name somebody on your life insurance, it will not go through probate. It will go directly to them. The only thing is, do not name minors as beneficiaries on your life insurance, because what happens is, if they turn 18 years old, they're going to pay $500,000 straight to that 18-year-old. That kid doesn't know what to do with $500,000. He's going to blow that money, right? So we always encourage that you create a trust, and make your trust the beneficiary. So you see, whilst you exit here, you still have control over your money. And when they turn to 21, okay, hey, you can access maybe 50,000. If you marry, oh, you can pay your wedding with 50,000. Oh, by the way, your grandchildren can now go to college with another 100,000. So you see, you still have control over your money. So do not make your minor children beneficiaries, because they're going to pay, if it happens, they're going to pay that whole $500,000 when they turn 18 years old and lump sum check to that 18-year-old. So life insurance do not go through probate if you have the right beneficiaries on there. And the other one is your 401k, IRAs, and all that. If you have beneficiaries on there, it's not going to go to probate, right? But also, hey, this is where we talk about, your property and all that, and estates transfer. So let's go to the next slide, and that would wrap up pretty much all the documents that we've been talking about. It all becomes part of your estate. So estate planning is very important, and these are all the 4 documents that comes together to become part of your estate. You definitely need a will, right? Will is great, because will literally, designate, who gets what and the beneficiaries. But will does not do everything, right? So you also want to have your living trust, because will only will come into effect when you die. But if you have a living trust, it works, you can control it whilst you are alive. And when you die, it becomes an irrevocable trust, because you are no longer here. You can fund a living trust with your home, depending on the type of businesses you have. It can also assume some of your businesses, right? You can fund your life insurance to your trust. So you see, if you fund, the trust is a simple document. It's just a box. That's what I call it. It's a legal document. I know people who have a trust, but it's not well funded. The document itself doesn't do the job. You have to be able to do a quitclaim deed to fund your house to the trust. So now the trust owns the house, you become the trustee, and you are the owner, like a nested ownership, right? So you have the trust as your head of the house, and you do a quitclaim deed to fund the house to the trust.
So real quick. So, and I hear this a lot, that if you just will, let's say, your house to your child, right? And you die, they pay a lot of taxes. But if you go through, could you elaborate a little bit about that, the differences with the will and when it comes to like a home?
Absolutely. So, we talk about the cost basis of your house and the step-up value of your house. You bought a house 20 years ago, 30 years ago, you paid off the house, you built so much equity in it, and you leave it in a will, right? Now the child has to pay that taxes on it. But if you have it in a house, because it is Joe Stevens Trust, and your children are named as beneficiary or owners of the house, they still own the house within the trust. So this is
so they don't pay the taxes.
No, they still value your estate, because just so you know, estate taxes are there. You still pay taxes when you die, by the way, right? So currently, the federal estate exemption is 13 million. It's 12.99, right? All that it means is if all your estate is valued at 14 million, you are exempted 13 million, and you pay taxes on 1 million. So just so you know, there's something called the sunset rule, which takes effect January of 2026. They are lowering the estate tax, the federal, to $7 million. So you see, people tell me that, oh, but I don't have a lot of, asset. Wait a minute. If you have grandfathered your trust as of 2025, you are grandfathered into the 12 million exemption.
Oh, interesting.
Right?
So we all got to do it before 2026. Is that what you're saying?
You are grandfathered into the 30 million exemption. But when folks say, hey, but I don't have that much money, well, I'm going to have more money, right? Maybe I don't have money now, but everybody's going to be rich. I mean, everybody's going to be wealthy, right?
Everybody's going to be wealthy.
Everyone is going to be wealthy. Yes. So what if I become so wealthy, I have over $50 million in wealth, and now my exemption is only $7 million? So why don't you put it in now? Because even your life insurance, like I said, if you fund it to the trust, if you have $2 million life, let's say your whole household have about $8 million in life insurance, that alone has passed the sunset rule. So you see, trust is very, very important. Living trust is important. You can transfer in, transfer out assets. So even if you want to sell your house, you can sell your house from the trust because the trust is the owner of the house, right? And you can still, put it in, take it out. So that's why we call it the revocable trust, because it's in and out, right? And the irrevocable is the one that you cannot change. So once you die, now all your asset in the trust become irrevocable, and then you go through valuation to see how much your estate is, and you have to definitely pay your taxes on that. So that's the living trust. That's the trust. And then the last piece, I think we talked about everything: yes. The financial power of attorney, and then the of course the medical power of attorney and directive.
Did you still have a question about the POA back there? You good? Answered. Alex, you have a question?
Yes. My question is, I think is generally related to discussion around wealth. As a financial advisor, what is your advice or take on the future of money and investment in relation to investing in assets like digital currencies and cryptocurrencies? I'm talking as a young adult growing, preparing for the future. What do you think about that?
Well, when it comes to investment and, all the new things that we have in our world today, digital space, stocks, they are all great. But you have to understand that they are all pieces of the puzzle, right? They are all pieces of the puzzle. When you are young, you have time. When it comes to wealth building, it's a relationship between money and time. So let's say you are 20 years old and you're going to retire at 60, you have 40 years. But if I'm 50 and I want to retire at 60, I only have 10 years. So those are the things you need to consider, know how much you need in retirement. And I always talk about the end in mind, right? And now put in all the pieces of the puzzle. But there's one thing I call the building block of wealth, right? 4 things. You need to protect yourself, number one. It's very important. Protecting yourself, protecting your life, protecting your health, protecting yourself protecting your ability to generate income is very important. Because when we talk life insurance and long-term care and all the insurance we're talking here, it is an income replacement strategy. So your ability to generate income depends on the fact that you can wake up tomorrow. Or I go down the street, 18-wheeler knock me down, I can no longer go to work. Do you think I'll have money to invest? Do you think I would have money to even pay off my debt? So that is the number one thing you consider when you are young. Because when it comes to protection and investment, when you don't have money, your protection is your investment. Because you buy back time if anything should happen to you, and you are able to rearrange your responsibilities. And then, when you become wealthy and you have investment, you are overinsured. But guess what? Even the wealthy, they even insure themselves even more. And that's how they leave legacy and generational wealth for the next generation. But when you're young too, that is when it's affordable. Because there are 4 things that goes into insuring you: your gender, your age, your health, and of course, the policy value. That is the 4 basics goes into it. As we get older on the curve, whilst we are navigating the challenges of inflation, taxes, and sometimes the losses in our portfolio, how do you know that I'm going to get there? How do I know that I'm even going to get to age 80 whilst I reap my retirement? I don't know. So that's why the first thing is to protect yourself. The next thing, obviously, you need to manage your debt. So it's not even just about investment, but these are all the building blocks. You manage your debt, make sure you manage your consumer debt. But you also have to be dangerous enough and be sophisticated enough to learn how to use debt to build wealth. Because in our community, we tend to be afraid of taking loans, right? But you can use debt, good debt though, to build wealth, whether it's investing in homes, asset, IPA, income producing asset. You still need some funding, right? So that is what I call a good debt. But your consumer debt, zilch. The next stage is emergency fund. You always need to have about 3 to 6 months. That's what everybody say. But for me, I believe that you need about 12 months. Because when COVID happened, folks stayed home for a full year without a job. If I have 12 months of emergency fund in the most liquid account that I can access, now I can transition from one career to the other. I can still stay home for 6 months and decide to go to work after 6 months because I know my monthly expenses will be taken care of. If you have this structure in place, now you think about investment. Because guess what? You have protected your base, your structure. And now all that investment is growing uninterrupted to when you retire. So that is why we always start with the end in mind. You need to know your numbers. When are you going to retire? How much money do you need to retire? We always recommend about 20 times your annual income because typically people live 20 years post-retirement. So if you have 20 years of your annual income saved up in retirement, you retire at 65, you would never need money until age 85. But even better, the kids are out of the house. But these days, the kids are smart. Even at 25, they don't want to go be on their own and pay rent, right? They are smart. But typically at age 65, they are independent and they are out of the house. So now, and the house would have been paid for. So you see, the 20 years of income you saved up, it can stretch you to 30 years. And you can live up to age 95 without needing money. This is what we need to know. You need to know when you want to retire. You need to know how much you need to retire with and set specific, targeted financial goals so that you know the length of time that you have. I have 40 years. Now, when I invest in crypto, when I invest here, when I invest there, am I blending my portfolio so that when I get to retirement, I don't have to surrender or liquidate a lot of my money in taxes? And am I still going to get to that 20 times my annual income in retirement? So it is kind of, it's a playbook. And you need to design it well. So all those are good. They are all pieces of the puzzle.
All right. I want to see whether there's a...
I have one question.
Yes, sir.
Setting up a living trust.
Yes, sir.
Which professional is the best to approach? Your CPA, your financial planner, or your lawyer?
Oh, that's a great question.
The answer is Anita.
That's a great question. So let me tell you what. You can do a self-prepared trust. You can do it on your own. But of course, you may not know all the lingo, right? And all that. So obviously, you can seek my help as well, and I'll be able to help you. I know that what I always add, and we also work in collaboration with other attorneys. Of course, people have different type of assets, right? So if you have really sophisticated businesses, we definitely want to get attorneys in, right? Just to make sure from a tax perspective.
But you have the attorneys you work with, so
Absolutely.
if it goes through you, you can
Absolutely.
help
So
set that
yeah,
up.
we can always help you with your, especially if you have your simple document like your POA, like Dr. Susie came and brought some copies, so you can self-prepare it. But for your trust, if you're doing a simple trust is where you just put your house in it, your life insurance.
All right.
Right.
Do you
Or
have a
something.
question on Zoom, or that's going to be the final question?
Question on Zoom.
Anybody?
What are the thoughts on doing a quit claim deed on your house into an LLC versus trust for protection?
Come again?
What are your thoughts on doing a quit claim deed of your house into an LLC versus trust for protection?
I would definitely advise a quit claim deed into a trust because you still own the trust because you may have a business, but a business, depending on how a business is structured, a business is its own entity too, right? A business is an entity. If you are in a real estate investment, you're using your house as a rental, property, your business can own the business. So everything goes through your business, finances, right? Financials. But, if your house is totally paid off, it's better to put it in your trust and do a quick claim. Or even if it's not paid off, you can still put it in a quick claim. I will normally recommend putting your house in a trust. But if you have a sophisticated real estate investment, then that's something that we would definitely, have to speak with an attorney to help you with that.
Okay, we have to wrap up. I think I have a final question because I want to make sure we finish on time, and I want to get a little bit personal. So for the three of you, all of you manage your own business. Some of you work in corporate America and you manage your own business. Could you give us some tips on running a successful business? That's the first question. The second question is, how do you have that work-life balance? Because that always comes up, especially, how do you balance between, your work and your family? So I know I want to get a little personal. I want to start with Maxwell.
Wow. So,
your wife is here, so she's listening.
Yeah. So, first of all, why did I want to run my own business? I always tell people that me personally, I'm born and raised in Abusokai. I'm stubborn, and I have ADD when I was growing up. No matter how some people think I'm nice, trust me, it's a facade. But I'm stubborn, and I don't think I can work well with people, but I always want to be in charge. When I moved here in Houston, I was with the practice. I don't like to have a whole meeting just to decide what toilet paper we're gonna use, what light fixes we're gonna. It's just too much for me. I want to just make a decision and move on. So that's what drew me into running my own practice. Secondly, I have 4 kids. If I have my own practice, I feel like I can make my own time for them. So that is what drove me into having my own practice. It works well for some people, it doesn't work for some people. Work balance, my wife is my office manager. I know a lot of friends and colleagues tell me that's a stupid thing to do. I don't care personally. But my wife is my office manager, we share office. So the few times that I'm there with a life of a surgeon, at least, even if I don't see her at home or whatever, we see each other. So that's the work balance. And for me, too, my wife being part of my practice, she can decide to take a day off and spend time with the kids and all that stuff. So all those things factor into me working for myself. My wife will tell you, I don't care about money. That's one thing. People think, oh, yeah, no, I don't care. I grew up poor. So if I don't have it, I don't have it. But if I could be making gazillions working for a big firm and all that stuff, but that doesn't matter to me. The thing that matters to me is having control of my own life, my family life. I can just decide I want to go to Ghana tomorrow to see my mom, and hey, it is. But if I'm in the big firm, I have to ask permission. The thing that drove us nuts is when I was with, it's a little side joke, a little side info. When I was with one practice, every physicians, we have to map up our vacation for the year. So every physician map up their vacation, and they took their vacation. When it got to my turn, they said, "Oh, there's an audit, so you can't go." Guess what? I went anyways. I had planned for a vacation with my family and everything, and they're like, "Oh, sorry, you can't go because we have audit." Well, you guys went to yours, and it's my turn. Like, no, you can't go. So since then, I was like, no, we're not seeing eye to eye. So that's why I have my own practice. I have my own business, and it might work for me, but it might not work for somebody else.
That's why I say we're getting pressed now. Susie, Susie, I don't know how you're going to follow that. But
So, yeah, I still work in corporate America. I need them. I need them for certain things, so I'm there. And I started my business. It's two different areas, but it's all surrounded around healthcare. And I chose to do what I do because I love my freedom, number one. I can't say I like to roam and travel, but I guess I do. So I don't like the control of my schedule telling me, like he said, if I tell you I'm going, I mean it. I'm going. So that's why I decided to go in business. And yeah, it's kind of hard. Doing startups are not easy. If you're the first generation doing a startup, you have to buckle up. The first 5 years, you're not gonna make any money. So if you did it for money, you will be brokenhearted, okay? There is no money there in startups. The first 5 years is gone. But after that, you get to see something. And I chose my field because I'm very young, as you can see, but all my friends and everybody are old. I've dealt with geriatrics and older people for a long time, so it is a passion of mine. And I've had a lot of background with working with insurance companies. And so that's how I structure what I want to do and how I can pay back into my community.
Awesome.
So,
well said. Anita?
All right. Okay. Wow. I guess they spoke for me as well. But anyway, I'm also in corporate. I'm still a broker. I have my own business. I have multiple streams of income. And why did I choose, going into, my to become a financial consultant or professional? Well, for me, it was a personal story, right? So I've worked in corporate for over 20 years. But out of that whole 20 years, I still didn't know. I mean, not the whole 20, but up until about 10 years ago, I know how to manage my money. Why? Because I went to college. They taught me everything to manage corporate finance, not my personal finances. And I think that is very important. Because irrespective of your discipline, money is the common denominator that we all work for. Why not learn about it? Why not focus about it so that we can retire with dignity and respect? We work so hard. In our community, we have professionals. And that used to be me. Highly educated, but highly financially illiterate. So that was my story, and that was how I came into what I do as a financial professional consultant. I'm able to help families. But the other thing too is we always have to think about the fact that we only have 24 hours in a day. Can you compress 24 hours in a day? Can you have multiple streams of income? Because one stream of income, that's a gumbo. In the country we live in now, and in these days, that is a gumbo. So, like Dr. Maxwell has his practice, I'm sure he has other multiple streams through investment, through some partnership. Think about a passion that you love. It could be baking. It could be cooking. It could be kneading. It could be anything you do. Make it a business. Make it a business. We live in one of the greatest states in Texas. You can be a sole proprietor and still have some good tax write-off, right? Because that W-2, when you start making a little bit more money, you end up paying. How about you actually get some good tax write-off with your businesses? So think about making every passion a business. I'm just coming out of Atlanta from another event, and it was so inspiring to see people who look like me and you getting to the next level. And it's all about things that we see every single day in the stores. People branching off into hair products, makeup, but they've taken it to the next level, right? Just because they love beauty. I met one young lady who is famous, and she has an afro hair, but she is inspiring young children to be confident, and now she has her own brand. I know you all know Tabitha Brown, had an opportunity to meet Tabitha Brown. She is in organic products, right? She's an ambassador. So every passion you have, even if you enjoy planting tomatoes in your backyard, man, you can have an organic shop, okay, and still have a tax write-off. So for me, it's about compressing to 24 hours in a day. We need to have multiple streams of income, and that's why I do this.
All right, awesome. That is how. No more questions, please. That is how we want to end the program. I want to say a big thank you to the wonderful panel. We see you all in different phases in a community, but to see you in this professional setting, I think says a lot. Thank you so much for what you've done for us today. This is being broadcast all over the world, and I'm sure we're going to roll it to different phases. So, as you all know, this is the GaDangme Kpee 30th anniversary, and we decided to kick it off with giving back to the community. So, thank you all. Next week, we have our picnic at the George Bush Park, and then on the 20th of September, we have a big event, and you're all invited. Thank you all so much for joining us. Thank you.